Okay, seems to have steadied now. So yeah, let's start. So yeah, thank you for joining today's session. We'll start with introductions first. So I'll introduce myself. I'm Lisa Maynard and I'm the Claims Relationship Consultant for Zurich, and I'm joined by my colleague Becky Sutton, who's a Claims Relationship Manager. I'm very happy to introduce our three presenters today who will be joining. We have David Hounsell, who's the Senior Risk Consultant for Zurich Resilience Solutions. And today we partnered with Waitmans and we're joined by Hannah Bedis and Peter Forshaw, who are both partners in Waitmans. Just a few things to confirm. Today's session will be recorded and we'll send you out the link after the session. And also there'll be an opportunity for Q&A at the end of the session. So please feel free to drop any comments that you have into the Q&A tab at the top of the screen throughout the session. And then hopefully we'll have time at the end to go through all the questions. Okay, with that, I will hand over to our first presenter, Hannah. Over to you, Hannah.
Thank you. So I'm going to talk about mental health in the workplace. And first of all, I'm going to cover the risks associated with mental health in the workplace. Then I'm going to look at the legal liabilities. And finally, I will touch upon defensibility. So moving on to look at the risks then. I wanted to focus on three topical areas of risk. These are demands on staff post-COVID, techno-stress, and flexible working implications. I'm going to cover each in turn. So, looking at demands on staff post-COVID. There have been a lot of press coverage in recent times about the risk of burnout. Many press articles cite that work has become more demanding, workloads have increased, and this could be due to advances in technology and process management, the ability to monitor workflows better, but equally it could be due to unrealistic KPIs or targets or issues of understaffing. Whilst it might appear that understaffing is sector specific, such as in the care industry, there's been a lot of headlines around the NHS and junior doctors, but other areas as well. In reality, this appears to be an issue across the board. During COVID, people had increased workloads because their colleagues were off ill or isolating. Thankfully, that's less of an issue now. But COVID caused a lot of people to reevaluate their life choices and career plans. There was a surge in early retirement caused by the pandemic. And this, combined with the fact that many people are studying for longer and joining the workforce later, has resulted in many businesses struggling to recruit. In some areas, there's a workforce crisis. And where this is an issue, people are being asked to do more work than before. The work still needs doing, so it falls to those that are there. Moving on to look at techno-stress. There's some definitions there from the Oxford Dictionary and the Collins Dictionary, which I'll leave you to have a read of yourself. But in short, this is the increased use of digital platforms and new technology in the workplace. But actually, the reach goes much further. So, looking at types of techno-stress. There's a techno-stress theory, which identified 5 different factors that create stress around new technology. And this was adapted from a 2007 paper called The Impact of Techno-Stress on Role Stress and Productivity. And it was written by Tarafdar and others. And I wanted to touch upon this to see if any of these issues resonate either inside or outside of the workplace. So, what about feeling overwhelmed by a constant stream of information? We get many messages nowadays, whether they be instant messages via Teams, emails, group chats. People have work phones, they have their own private mobile phones, social media. Also, not only do we get the messages, but quite often we get a notification to say we've got a message. This constant barrage of information can result in some people struggling to prioritise due to that sheer overload of information coming at them at once. Constant interruptions affect concentration and attention spans. What about when the workplace technology intrudes or invades into your non-working time? So there's a blurring of lines between your home life and work life. Getting messages or notifications on an evening or weekend, and then feeling obliged to reply, being unable to switch off. For some, keeping up with the advances in technology is a challenge. The technology just feels too complicated, and they struggle to keep up with the constant updates to the technology that's being used. What about worrying that others know more about technology than you do? Or worrying that your job is at risk or will be taken over by a computer or some form of artificial intelligence? The pandemic accelerated use of technology massively. We had to develop new ways of working for businesses to function. Overall, the increased use of technology is really positive. There are a lot of benefits, savings, and efficiencies. However, excessive use of technology can have a detrimental effect on mental health and on job satisfaction and quality of life. As employers, it's really important to be aware of the potential impact that advances in technology can have. Moving on to look at flexible working implications, there are lots of positives of flexible working. It can increase productivity. It improves the work-life balance. There's no travel time. It can reduce travel costs as well. If you have happier employees, they're likely to be more loyal and to stay with the organisation. However, there are also some negative aspects to this. There's less opportunity for face-to-face meetings and collaboration. How do you train new recruits and pass on vital on-the-job skills? There's learning by osmosis. That's really difficult if you're not in the same space. It can be hard to separate your work and home life, particularly if you're still working off your dining room table, and I know that that still happens. People can be harder to manage from a distance. If there's a lack of productivity and you can't explain that because you can't see the person, that can be harder to deal with. What about loneliness? I know that this also is an issue, that the pandemic caused people to be at home and in their own space a lot more. Some still feel the struggle of going back to a busy office and are not ready for that yet. It's much harder to spot somebody struggling with their mental health from behind a computer screen. So moving on to look at the legal liabilities and stress at work claims. The most common examples are overwork, lack of support, and bullying and harassment. Here we're looking at a situation where an employee claims they've suffered psychiatric injury due to their work. These issues may be caused or affected by the risk factors that have been mentioned previously. For example, excessive work-related demands placed on an employee could lead to a situation where they suffer psychiatric injury due to that overwork. Lack of support is where an employee often claims that they've raised issues about their work and they haven't been responded to. They've not been addressed. Bullying and harassment are fairly self-explanatory, and Peter will talk more about violence and hostility in the workplace shortly. Stress claims may start out as or run alongside employment tribunal claims, and they can arise from the same or similar facts. However, it's really important to distinguish between the two different types of claims because the procedures and timescales are very different. I'm going to focus on civil claims. Moving on to look at how these claims are generally framed. And firstly, I'm going to look at claims in negligence. The required elements are, firstly, a breach of duty. So, for example, the claimant claiming that they're being overworked. Then causation. So that overwork, that breach of duty, has to have caused a psychiatric injury. Then there's an element of foreseeability that's required. Was the psychiatric harm to this employee reasonably foreseeable? What did the employer know, or ought they reasonably to have known? The harm must be obvious enough for a reasonable employer to realise that they should take action. You also need a recognised psychiatric injury, more than just distress. Looking at the defences available, firstly, if the harm wasn't foreseeable, that's an option open to you. Alternatively, being able to show that you've done everything a reasonable employer should. You don't have to take all steps. Employers must take reasonable steps to protect their employees from injury. And the limitation period for these claims is 3 years. So looking at a breach of contract of employment, this is something that often appears in stress at work claims. And it's often cited as the fact that there's a breach of an implied term in the employment contract, that the employer would keep the employee safe in the workplace, and or that they wouldn't undermine the relationship of trust and confidence. In reality, this adds little to a claim in negligence. Moving on to look at the breach of management of health and safety at work regulations. In light of the Enterprise and Regulatory Reform Act in 2013, the workplace regulations no longer impose civil liability. However, claimants will often use a breach of the regulations as evidence of negligence, so you may still see those things cited. Moving on to look at the Protection from Harassment Act 1997. Here the requirements are slightly different. So firstly, there needs to be a course of conduct. And what I mean by that is that there are at least 2 incidents which are connected in type and context. So do they include the same person? The incidents being related, either closely in time, that sort of thing. There's a high threshold in terms of the type of conduct that the employee was subject to. It has to be oppressive and unacceptable conduct that's akin to criminality. Conversely, there's a low threshold regarding the impact. Here you only need anxiety and distress. There's no requirement for a psychiatric injury. When we're looking at claims under the Protection from Harassment Act, again, there's no foreseeability requirement, and there's no defence for taking reasonable steps. The limitation period here is much longer. It's 6 years. So moving on to look at defensibility strategies. How do you limit your risk in order to avoid these claims or to defend them when and if they do arise? David will pick up on some of these things later in his talk, but I wanted to share some thoughts from a claims perspective. Whenever we're talking about claims and being able to defend them, documentation is always key. Starting here with things like policies and procedures, making sure you have them in place, making sure staff are aware of them and that they're followed. Monitoring work levels. What checks and balances do you have in place? How do you monitor workloads? Regular one-to-ones and appraisals or check-ins. If you are having regular meetings, ask if there's anything people want to raise or are concerned about, and note even a negative response. Make sure you document any complaints and actions taken, even if it's by way of an email. An email trail will suffice to document that sort of thing. Training records. Can we show that we've trained an employee to do things a certain way? Has there been a grievance? Has this issue in fact already been considered? If there are issues about mental health in the workplace, you may want to look at stress risk assessments and occupational health referrals. If you do use these processes, it's really important that you document the follow-ups, that you act on recommendations and any reports obtained. Make sure HR and the department in question are working together. It's really important here to avoid silos. Also, promoting staff well-being and mental health support. Most organisations have a dedicated area on the intranet. Have a think about what support is offered and available and how you make employees aware of this. Over to you, Peter.
Thanks, Hannah. So, whether you handle claims, whether you run a business, or whether you're aware of it from the media or from going about your daily lives, the chances are you have experienced some form of violence or hostility in the workplace, whether aimed at you or witnessing it as a bystander, and whether in your own workplace or the workplace of someone else. Indeed, just the other lunchtime, I witnessed an escalating and uncomfortable altercation between a shopper and a retail assistant in my local supermarket, which just proves you can't escape it wherever you go. So over the next 15 minutes, I want to run through the challenges faced by employers, the legal liabilities and defensibility opportunities in respect of violence in the workplace. So to identify the risks and know how to deal with them, we need to be able to recognise what we mean by violence or hostility in the workplace and perhaps distinguish such behaviours from what might be described as workplace banter, the sort of kind of jokey comment or action that makes the working day just that little bit more bearable. Well, the HSE describes the sort of conduct we're focusing on here as any incident in which a person is abused, threatened or assaulted in circumstances relating to their work. So you can tell from that the scope of the offending behaviour is wide-ranging and covering physical violence and sexual assault, verbal expressions, specifically bullying and harassment, as Hannah mentioned, face-to-face aggression, as well as aggression perhaps over the phone, and increasingly in this day and age, expressions over email, WhatsApp and other forms of electronic communications, many of which pose greater risks as they can sometimes be anonymous or have no context, and therefore the tone can be more easily misinterpreted. And as my supermarket example showed, it's not just altercations between work colleagues, but it includes episodes of hostility between staff and third parties, such as contractors or members of the public, and whether initiated by our staff or against them. So as employers, we need to be ready to protect against all those possible scenarios. Now, there have, of course, always been isolated examples of such behaviour in workplaces. So to that extent, it's nothing new, I accept that. But the issue does seem to have become more prevalent and widespread in recent years, as a review of recent news reports and surveys shows. Now, the HSE haven't collected statistics on workplace violence since about 2020, but at that time, they were showing about 688,000 incidents that year, likely far greater if that survey was done today. And I say that because more recent surveys would suggest a growing problem. So the British Retail Consortium in February 2024 reported 1,300 violent or abusive incidents per day, up from 870 per day the year before. Now, the government response to that was the launch of Project Pegasus, which involves sort of use of facial recognition technology and the use of AI to track offenders. Now, that, of course, is not without its own liability issues, including examples of inaccurate recognition, leading to allegations of defamation and unlawful detention, and thereby escalating tension itself. So a bit of a circular argument. But as you can see from this slide, train workers, ambulance workers, medical officers, theatre staff are just a few of the professions reporting rising violence. Now, we can speculate as to the reasons for this. No doubt one factor is the increased awareness of the issues and employees' rights, and people feeling more empowered to report such experiences, which is certainly a positive development. However, there are other factors at work. We've got stress and mental health issues, as Hannah referred to. We've got socioeconomic pressures, such as the cost of living crisis, triggering anger or resulting in people taking increasingly desperate measures, such as shoplifting. We've got the pandemic and a move, what in my opinion is a sort of more of an on-demand or entitled society where people become increasingly frustrated when they can't have what they want when they want it. But whatever the reasons, this is an issue to which we need to be alive, to protect our employees against such occurrences and protect ourselves as employers from being liable for such incidents. Now, given the news headlines, such risks are becoming increasingly foreseeable now. Whether that results in more claims is a separate issue, and there is a sort of a divided opinion on that. I know some of our clients will say that they haven't seen an increase in claims, but claims that have recently been presented to us to handle include, for example, sexual assaults by security staff in changing rooms and violent attacks initiated by workers described as difficult against fellow employees. Now, some of these claims have big six-figure valuations attached to them, even before one considers the reputational damage caused by such incident claims. So it's certainly something we need to take seriously, in my opinion. So to help prevent incidents and avoid liability, it's necessary to understand the scope of the potential legal liabilities of employers and others in control. Now, here and on the next slide, I'm talking about failings by organisations, their own failings, be that by way of defective systems, policies, procedures, or actions. Now, the starting point is, of course, the Health and Safety at Work Act 1974, and the duties to ensure, so far as reasonably practicable, the health, safety, and welfare of workers. Now, that includes protecting them from work-related violence. But note, of course, that this is not an absolute duty, provided an employer has taken requisite and reasonable steps, which we'll consider shortly. But there are, of course, duties to assess the health and safety risks to workers, and that assessment includes the risk of work-related violence. There's a duty to appoint competent people, and that's a particular allegation that we often see pleaded in cases where a rogue employee has initiated unwarranted behaviour against colleagues. There's a duty to provide information and training to workers on a variety of issues, including behavioural issues. However, on this issue, a less referenced provision in the Act is important, I think, and that's the requirement that workers themselves are required to use the information and training they've received and to report dangerous situations or failings in health and safety arrangements. So again, staff should be reminded of their own responsibilities in this regard, which will help employers satisfy theirs. However, the 1974 Act is not the only way that an employer could be fixed with liability arising from episodes of violence, hostility, and aggression. We mustn't forget breaches of the common law duty of care, as Hannah's referred to. Now, whether the recipient of the violence is one of your own employees or indeed a visitor to your premises, the existence of the duty of care will usually be fairly clearly established, as will causation. But the mere fact that the violence or hostility has occurred at work does not automatically give rise to a direct liability. This will depend on the foreseeable risks appertaining to the particular work environment and employees concerned, and what control measures are required to be implemented by the employer to protect their staff and visitors. Now, in this regard, the requisite risk assessment required by the Management of Health and Safety at Work regs will be key, as will the RIDDOR requirement to log reportable incidents. Now, in respect of assessing the risks in a workplace environment, context is everything. So, for example, employing lone retail workers at night in areas with high crime rates will give rise to greater responsibilities and different considerations to those where we're employing staff in daytime hours and there's been no previous incidents. Equally, those employing staff in highly pressured, quick turnover environments will give rise to a different range of necessary measures to those employing staff in sedentary office-based jobs, for example. And those who are working in segregated are likely to require different considerations to those who are mixing directly with others and the public. And as Hannah's already touched on, the common law and the 1974 Act are not the only way that direct liability may arise for employers should a violent or hostile incident occur. Claims may be founded under the Protection from Harassment Act 1997 or arise out of direct or indirect discrimination under the Equality Act 2010. And indeed, recent examples we've dealt with have been how employers and their staff have maybe struggled sometimes to deal with the neurodiversity of customers attending their premises. It's perhaps easier to accept liability, I suppose, where there are clear failures to identify and control and manage the risks of violence or hostility by the employer themselves. However, claims can be brought for such acts in the workplace where there is no explicit fault or failing by the company. And this is a form of strict or no-fault liability. Now, it's not entirely strict, to be fair, as there is a two-stage test which a claimant must satisfy in order to fix the employer or other organisation with liability. And this two-stage test has been the source of much judicial consideration over the past decade or so. So stage one, well, that's the relationship between the wrongdoer and the company being sued. And is that close enough to give rise to vicarious liability? That's what we call the akin to employment test. Is the relationship one of employment or one that is akin to employment? And by that, I mean, i.e. not a true independent contractor and client relationship. Now, in most cases, the relationship will be clear. An offending employee will clearly satisfy the first stage of this test. However, others not directly employed, but who are conducting the functions of the employer at their request and under their direction and control may fall into the akin to employment category. So simply delegating activities and responsibilities to the staff of other organisations will not always create immunity for yourselves. And even if a claimant can overcome that first hurdle and the first stage of the test, they must still satisfy the second stage, and that's namely the close connection test. Is the wrongful conduct so closely connected with acts that the wrongdoer was authorised to do that such violence or other offending can fairly and properly be regarded as being done in the course of it? Now, of course, at first glance, that just seems nonsensical and unfair. How can an act of violence be said to be authorised or closely connected to an authorised duty? However, this second stage of the test requires careful consideration of the authorised roles and responsibilities that the offending perpetrator has, and then the closeness to the hostile act committed. And I'll just go through a few examples because a review of case law over the last 20 years shows employers being fixed with liability in a range of circumstances which at first glance may seem unfair. So in Mattis and Pollock, we have an employer being held responsible for a knife attack by a door supervisor. Bellman, we have the employer responsible for an assault by a manager at a work Christmas party. In Kuoni, we have a tour operator liable for an assault carried out by a hotel staff on a guest who had asked for directions. And then in Mohammed and Morrison's, we have a retailer being held liable for sales assistants pursuing and attacking a customer. Now, this is the case in particular that for me caused most widespread concern as to how broadly this two-stage test may be interpreted. In Mohammed, by way of example, it was held that the authorised act was dealing with the customers, and therefore, because out of dealing with the customer came an argument and the attack, then Morrison's were held liable. Now, thankfully, in more recent years, a range of cases have sought to redress the balance and protect employers against being held strictly liable for the actions of others. So in Barclays Bank, for example, they were not held liable for sexual assaults conducted by an independent doctor conducting their pre-employment medicals. In Shell and Tarmac, the employer was not held liable for the employee's horseplay of firing a gun pellets at work. The school was not held liable for a sexual assault of a schoolgirl conducted by a former pupil on their on-work experience. And the trustees of Jehovah's Witnesses were not held liable for a rape by one of their elders. However, what's slightly worrying in those cases, in some of them, such as Barclays, it took escalation to the highest court in the land, the Supreme Court, to overturn the Court of Appeal's view that Barclays were in fact fixed with liability for the sexual assaults by the examining doctor. And in other cases, it's clear that it would take only slightly different factual circumstances for the employer to be fixed with a liability for the violent acts of others. So, for example, in Shell, the pellet gun case, the court appeared heavily influenced by the fact that the perpetrator had injured the claimant by a pellet gun that they brought from home and that hadn't been provided or required to be used at work. So arguably, the outcome could be different if the injury had been caused by equipment provided for use at work, and more so if the incident, I suppose, arose out of an argument around the methods of working being carried out. So whether potential liability is direct or that sort of no-fault indirect, the key to minimising the risk of events occurring or protecting yourselves against liability as an employer will be the measures which you put in place. And the crux of that will be your regularly reviewed risk assessment. And I put on here just a few considerations that as an employer, we're probably going to need to consider, but David will obviously touch on risk prevention as well. So some of the factors to consider: you've got the workplace, the space that's being employed, the layout of that space, what is the lighting, where are the blind spots, areas where tension may escalate. For example, if you've got areas where people are going to be queuing or where delays are going to occur. Consider your security measures in that environment. Will you have CCTV? Will people need to use body cams? Will there be security staff positioned? Are there alarm systems available? Should signage be erected? I think we're probably all more used now to seeing a lot of signs around places saying, please respect our staff. But then also considering your risk assessment, the work done, whether there's lone working, whether staff levels are adequate, whether there is interaction with the public. All of these things could contribute to a potential risk of violence. In almost all cases, there'll be a need for training and instruction to prevent and manage violence and hostility. And this instruction and training might include the need to treat colleagues with respect, understanding that violence and hostility will not be tolerated in the workplace, being able to recognise the early warning signs such as body language and what to do when spotted, training on interpersonal skills such as verbal and non-verbal communications, the importance of logging incidents so that that can be acted upon. Sometimes it might include training around physical intervention techniques where there's a high risk of serious personal aggression. And similarly, there may be a need to undertake de-escalation technique training. That's making staff aware to how to calm situations down and prevent violence and aggression from escalating. So that might be including being polite and using a clear, calm voice, having a relaxed posture when dealing with others and keeping hands by your side, keeping a safe distance from those who might be becoming aggressive and allowing them their personal space, facing the person and maintaining eye contact, showing empathy and that you're listening and acknowledging their feelings without necessarily accepting them, avoiding raising your voice or arguing. The supermarket lunchtime example I used a few moments ago, the retail assistant didn't avoid that trap and got embroiled in an escalated and already hostile situation. And also offering alternative solutions to a problem so that the person has a way out other than aggression. But avoidance of liability and protecting yourselves as employers is also likely to require you to need effective HR systems, including rigorous vetting of new recruits, diligent disciplinary repercussions for unacceptable behaviour, clear job descriptions so staff know what is and isn't acceptable, all part of their role, agile segregation of staff where the first signs of tension arise, and policies around acceptable use of IT and social media, as Hannah touched on. Linked to that is the need to log and act on incidents at the first sign of trouble, and the taking of effective, swift measures by HR to stamp out such initial signs. In too many cases that we see emanating claims, violence is described as having been simmering for some time in that workplace and it almost being an incident waiting to happen. And sadly, the employer hasn't dealt with it at source. Staff engagement is also key. Regular consultation with staff regarding the effectiveness of the control measures in place, asking staff regularly how safe they feel and what more they would like to see introduced to help foster a safe working environment. But equally, in respect of acts committed by third parties, such as the security guard example I touched on before, clear contracts for services should be in place, which will include indemnities between the parties, who is liable for what. The contract should document the clear allocation of roles and duties, and the same expectations around the vetting and training of staff, which will help minimise the risks. Of course, one will never stop such incidents occurring, but such measures will reduce the chances of those incidents occurring, and at the very least protect you against a finding that you were at fault. And finally then, so what of the future? Is this sort of rise in workplace violence an issue that's here to stay or just a short-term problem? Well, on this final slide, I set out what we might expect from the new Labour government. Well, whilst there have been some commitments, like the new standalone criminal offence for acts of violence against retail workers, that may act as a deterrent and help reduce the prevalence of violence in the workplace in the future. That doesn't, of course, apply to other industries. It's just the retail sector. And elsewhere, the new worker protection legislation, focus on workers' rights in the manifesto, the possible extension of vicarious liability to make organisations liable for the acts of others right across the supply chain, And the likely review of safety protections alongside the unions means that probably more will be required of employers going forward, and employers will need to remain vigilant in respect of such possible violence. With that, I will hand over to David.
Thank you, Peter. So in this part of the webinar, I'm going to move on to give a risk management perspective on the subject of mental health, stress, and hostility in the workplace. I think this is the most complex employee health issue that I've ever had to deal with in the last 25 years, but it's not an impossible one to manage. And today I hope to give you some insight and a bit of food for thought. So this is what I'll cover in my section today. These 5 points. The reason for including the quote, from Desmond Tutu, is that I tend to find a lot of organisations focus on individual mental health and resilience and return to work programmes than they do on the prevention of harm. So whilst resilience and rehabilitation are important, on their own, they do not represent good risk management. The next slide, please, Peter. So this slide shows some of the HSE's stats for stress at work and violence at work. It can be hard to compare the two, partly due to how the two sets of data are collected. But for example, the stress statistics are quite good on causes, though it's worth bearing in mind that although they're released every year, the data on causes hasn't been updated since 2015. The stats on violence are not so good in terms of causation. For example, they only note physical injury. And Peter gave some examples of other sources of information that are often sector specific that you might find more useful. So there's no mention of the link to ill health when no physical injury has occurred in the HSE violence at work statistics. But when we look at the causes of stress, depression and anxiety, which are the measures the HSE use, we can see that harassment and relationships are the third and fourth highest ranking causes for people to be absent from work due to SDA. And the common link to my mind between these two things is fairly simple. It's human beings, specifically their planned and responsive interactions and intersections through the day. I believe the best way for an organisation to identify, analyse and mitigate these risks is through a risk management approach, which many of you will be familiar with. And this includes, as Hannah said, leaving an effective audit trail of documents and records for both organisational learning and, if it becomes important, for claims defence. So this means using a similar risk management approach for psychological health and safety that we might use for physical health and safety. As we've already heard, UK health and safety law does not differentiate between physical and mental health. The employer must manage both. The new ISO standard and World Health Organization mental health guidance, both been published in the last 2 years, sort of indicating where, the movement, the increased focus on these issues. Both refer to psychosocial hazards and psychological health and safety rather than just mental health or stress. And this helps us sort of provide a more integrated approach to dealing with the subject we're talking about today. And they also put much more focus on prevention rather than just rehabilitation and resilience. A study published in April of this year analysed data across 45 countries. It notes the top global psychosocial concerns are harassment, bullying, work overload, discrimination and a poor work-life balance. So it's not a UK specific issue. We can look to other countries for clues of what we can do. The paper also notes the main driver for managing these hazards is workplace senior management support and having specific national regulations, something that the UK is currently lacking in terms of a requirement, a specific requirement to both manage stress or workplace violence. The main barrier is noted as poor resource availability, and that doesn't necessarily just mean money, it might mean expertise as well. So our first two organisational implications are the link between these two risks, and that we can use a common approach, one that might be already familiar to us as good risk management practice. Other implications we can look at in terms of how they support sustainability, and Peter mentioned increasing Labour government might be making links to ESG, and also the more traditional bit for risk management insurance of managing costs. As long ago as 2014, Department for Business Innovation and Skills, remember that, published a report called Does Worker Wellbeing Affect Workplace Performance? Guess what? It does. And a couple of interesting quotes I've selected from that. There's compelling evidence that higher levels of life satisfaction and effective feelings have a causal effect on health and longevity. We live longer if we're happy. Mental health also has an indirect effect because individuals with better mental health are more likely to engage in health-promoting behaviours and practices, including more positive social relationships that support better physical health. So we've got a virtuous circle effect with mental health. Better mental health improves our physical health and helps reduce losses to the individual and therefore the business. Secondly, the report notes that better mental health positively correlates with increased creativity, problem solving, processing of information, and even risk-taking. Interestingly, the study found a strong positive correlation between measures of job satisfaction and so-called organisational citizenship behaviour. For example, respect, civility. So workers who are more well are more likely to behave in ways that improve workplace culture, its diversity, equality, and inclusion. Again, we see the link between workplace mental health, stress, and hostility, just showing it in a more positive light. Last implication is assurance on the risk management side. Using a risk management approach that aligns to the ISO standard or one of the many ESG reporting frameworks that are available can provide your stakeholders with an assurance that the risks are being effectively managed and demonstrate that your organisation is a good corporate citizen. So if we look at the cost implications on the employee benefits side of the insurance business, particularly income protection, we can note a couple of things. Mental health represents over 20% of income protection claims. 54% of return to work support, regardless of the actual cause for the claim, is around mental health. So someone who is off work because they've broken their leg is more likely to use the support for the mental health implications than they are for the physical injury for which they're claiming. The highest number of liability stress claims are in the cost range of around £50,000 to £100,000 and commonly take about 2 years to settle. Most claims, certainly with Zurich, are defended and each is considered on its merit. As such, they're very time consuming for all parties, whether or not they are successful for the claimant. Our mental health support within our claims proposition is very effective at 1, reducing duration of absence, 2, successfully returning a person to work, and 3, reducing, in consequence of the first 2, reducing the likelihood of them putting a claim in. Increasingly, ZRS, Europe Resilient Solutions, is looking at the relationship between mental health and well-being, stress, violence, and other types of loss, for example, physical injury, as I just mentioned, road traffic collisions, so distracted driving, for example, traumatic events, and even property loss and mental health impact. Something that's been very interesting is the use of employee assistance programs following flooding events, for example, with domestic insurance. So we're trying to sort of use a more holistic approach, if you like. So psychosocial risk of mental health are complex issues at an organisational and an individual level. But having Zurich work through your policy, strategy and practices with you can be insightful for you and help trigger more well-considered improvements, initiatives and interventions that help realise some of the benefits that I've mentioned on the other slides. So while your organisation may not use any of the ISO standards, as risk managers, you probably recognise the Plan, Do, Check, Act risk management structure, and that's used within the ISO standard for psychosocial risks and mental well-being. It's a supplement to ISO 45001 for occupational health and safety management. And it looks at purely work-related issues, specifically how work is organised, social factors within the workplace, and the more traditional aspects of work environment, equipment, and hazardous tasks, things that both Peter and Hannah have mentioned. So on the slide, I've included the ISO clause numbers on the little hexagons there. Using this sort of framework for risk management does give a number of benefits. It gives us a familiar framework, something that will align with other standards that you may use for quality management, environmental management, as well as health and safety. And it focuses on aspects of psychosocial risk and mental health and well-being that are in the employer's area of control or influence. So the way in which work is organised, e.g. demands, social factors, so relationships between managers and staff and workers themselves, and the psychosocial aspects of more traditional risks. So equipment could be ergonomics, tasks that people do, dealing with challenging behaviour perhaps, and the workplace itself, so noise, vibration, even down to lighting and thermal comfort. So systematic risk-based approach to the management of this growing risk can help create a positive working culture that helps people to flourish as well as just protecting them from harm. So I would say, if I were asked, the top 4 actions that are worth considering is 1, reviewing your mental health and wellbeing strategy and policies. You could add into that how you manage workplace violence, harassment. Carry out psychosocial hazard identification and risk assessment as you would with other proactive risk assessments, as opposed to using it as part of return to work. Train your managers in mental health and well-being so they know how to fulfill their part of your health and safety policies. And the 4th one, to raise the mental health and well-being awareness or literacy within the organisation. This is linked to concepts around psychological safety, where people feel that they can be themselves and that they can speak out and discuss things freely. Within the overall framework, I won't go through everything, but there's a couple of the points within the cycle there that I will just draw your attention to. Support mechanisms, number 7, include competence, awareness of psychosocial mental health issues, communication, documentation, and confidentiality. So if you think about classic claims defence issues here, and Hannah mentioned these, were the people competent? How well were they informed about the risks? Was their performance and problems discussed with staff? Is there documentation and records available for all of these things? And within operational risk mitigation, the ISO standard breaks these into 3 categories, and that is, as shown on the slide there, primary interventions, which focus on reducing risk, secondary interventions, which focus on resilience, and finally, tertiary interventions, which are your rehabilitation bit. And the last one I'll specifically mention there is around performance evaluation. So it wouldn't be a risk management presentation if I didn't say what gets managed, what gets measured gets done, or you can't manage what you don't measure. People often take this as meaning objective or quantifiable data, things like absence data or accident records, but we should also look and consider about collecting subjective, proactive data around employee surveys, psychosocial risk assessments, and even the completion of proactive things such as training and awareness sessions. And the last bit that will link in and help support some of the things that were mentioned earlier around claims defence and the sort of records and documents that will be needed. So a clear policy for reporting stress and mental health concerns and how this has been communicated. suitable and sufficient psychosocial risk assessment or stress risk assessment, and appropriate risk controls, looking at primary, secondary, and tertiary interventions. Contemporaneous notes of meetings with individuals who have reported symptoms and what actions are going to be taken. And finally, keeping up to date with good practice. Initiatives that benefit the collective workforce over the individual have been a principle of protection in health and safety law since 1992, together with the use of risk assessment. Many organisations, in my experience, tend to put more emphasis on the use of individual approaches for mental health. One of the key problems with this is it's very much up to the individual to engage with these initiatives. There's been many studies over the years to look at the relative effectiveness of different interventions in improving mental health and well-being. And one of the best known ones is Deloitte's Mental Health and Employers Refreshing the Case for Investment. This first came out, I think, in 2020 and tends to get refreshed every sort of 18 months or so. These give a good steer. There's a couple of others from World Health Organization and the HSE who also provide a bit of information about the relative effectiveness of different interventions. But it needs to be right for you and your organisation. One thing I will point out from the Deloitte report is some of the characteristics of the interventions that provide the highest return on investment, biggest bang for your buck, is they offer a large scale cultural change or organisational wide initiative that supports a large number of employees, i.e. a collective approach. They're focused on prevention or designed to build employee resilience. So prevention is better than cure. And they use technology or diagnostics to tailor support for those most at risk. So it's targeted to those most in need, either because of the job that they do or because of personal circumstances. And this fits in with general concepts of using a risk-based approach to focus our energies and resources. So interventions in the collective group at the top of this slide tend to focus on prevention and risk mitigation. Individual interventions at the bottom tend to focus more on resilience and rehab at an individual level. So I would ask you all to think about where do most of your mental health and well-being, violence and hostility policies and practices sit on this sort of scale. This last bit really is echoed by things that Peter and Hannah have already said, but it's just a way of breaking down the sort of aspects of psychosocial hazard, risk management, and health promotion and education. I often find that customers I speak to are actually doing more on this than they think, and quite a useful exercise is to map all of various policies, practices on risk management and also promotion, education on the health side of thing against a fairly generic set of psychosocial hazards, such as in this case, job demands or interpersonal relationships. And this helps to sort of, and whilst it's not giving any indication of how effective these things are being implemented or actually whether they're the right things to do, it's quite a useful way of just getting a view of the general maturity of the system and how aware the organisation is of the issues. And one thing I'll just mention on cases, one of the ones that a couple of cases, Hatton set out 16 Hatton principles, which have been updated more recently with the case of Bailey versus Devon Partnership NHS Trust. A couple of things is worth just noting from the case of Bailey is that the health and safety landscape has changed considerably in terms of what is expected in terms of adequate risk assessments for mental health. And bear in mind, this is from around 10 years ago. The duty to assess risk in relation to stress in the workplace should now arise at a much lower threshold than set out in Hatton. Assessment might well put an employer on notice of the need to take adequate steps to prevent an employee from psychological injury without that employee actually deliberately or explicitly notifying them that they are having a problem. Employers cannot sit back and do nothing about workplace stress. A safe system has to be proactive for it to be most effective. And employers must heed and act upon HSE, Chartered Institute of Personal Development, and international guidance available. They must move with the times. So, last slide, please, Peter. So just by way of a summary, these are some of the key bits I think it's worth bearing in mind. And I'll just draw your attention to the last one. Social isolation is generally not good for our personal well-being, and it's not a good way to manage mental health, well-being, and hostility in the workplace either. So it is a complex situation with no quick and easy fix. So I do suggest talk to people who can offer useful support and insight. And that's it for me. I think our next slide, just to give you guys a bit of chance to give us some feedback on today, is the QR code. But I think also I'm going to hand back to Becky to do a little bit of Q&A.
Thanks, David, and also thanks to Peter and Hannah. I think everyone will agree that was a really interesting and informative discussion. As David said, the QR code here, if you wouldn't mind completing a feedback form. I've also just added in the chat the link to the form, if people wouldn't mind, whichever's the easiest option. And we've only got 1 minute left for any Q&As. If anybody does have anything, we can pick it up separately. There's one question in there, but if anybody wants to add anything, please put them in now, because we will follow them up after the event. So we've got one question in there, probably for Peter or Hannah. Do employees still need 2 years service to put a claim in for mental health damages?
So, yes, I'll happily pick that one up. Thanks, Becky. Actually, there is no requirement regarding length of service for a personal injury claim of this type. Although what I will say is that often stress claims do involve allegations and incidents going back a number of years. So actually, you quite often find that they go back even longer than those 2 years, but that isn't a specific requirement. It's just if those other elements that I talked about are all present.
Brilliant, thank you. Thanks, Hannah, that's great. So it is 11 o'clock now, and I think people are starting to drop off. So anything else that comes in, we'll pick up after the event. So apologies, but we'll send something out with the recording and cover off any questions. So thanks everybody for joining, and I hope you have a good rest of the day.